Factor mimetics are part of a broader range of investigational therapies for hemophilia A, aimed at improving bleed control, treatment adherence, and quality of life. Factor VIII is an essential cofactor that accelerates factor X activation by factor IXA during normal blood clotting. However, patients with hemophilia A are deficient in factor VIII, resulting in poor hemostasis. Factor VIIIa recognizes multiple binding sites on factor IXA and factor X and has full cofactor activity, including promoting phospholipid binding, stabilizing factor IXA active site, bridging factor IXA to factor X. Factor mimetics are engineered molecules that mimic the function of clotting factor VIII, without being identical copies. Instead of replacing factor VIII, they bridge the gap in the clotting process using different mechanisms. Factor mimetics offer several advantages over factor replacement. They are delivered via subcutaneous administration instead of IV infusions. They have longer durability and less frequent dosing, ranging from weekly to bi-monthly. And they are effective in patients with inhibitors. Emicizumab is a bispecific monoclonal antibody approved in 2017 for prophylactic treatment of hemophilia A for patients with or without inhibitors. It binds activated factor IX and factor X, mimicking the cofactor function of factor VIIIa in the coagulation cascade. Next-generation bispecific antibodies under investigation include NXT007, which has structural modifications designed to enhance binding and reduce dosing frequency, Mimetics, which better stimulates proteolytic activity of factor IXA to activate factor X. Preclinical and early clinical data suggest it may allow effective clotting activity at lower doses, with extended dosing intervals under investigation. INO8, an oral factor mimetic that is approximately 5 times smaller than immunoglobulin G antibodies, conjugated to fatty acids to bind serum albumin, prolonging the plasma half-life of the agent. Comparative studies indicate that next-generation mimetics are significantly more potent than first-generation agents, both in vitro and in animal models. Key areas of ongoing research include safety and immunogenicity, long-term efficacy and durability, comparative effectiveness versus standard factor replacement. Thrombin generation serves as a key indicator of factor VIII mimetic potency, reflecting their ability to enhance factor IXA-mediated factor X activation and overall hemostatic efficacy. Current safety considerations for factor mimetics include thrombosis risk, particularly in combination with activated prothrombin complex concentrate. Experts now recommend using activated recombinant factor VIIa as the preferred bypassing agent for breakthrough bleeding or surgery during therapy. Factor mimetic therapy represents one of several evolving strategies in comprehensive hemophilia care that supports individualized treatment goals. Treatment decisions in hemophilia should be individualized based on clinical needs, access, and patient preferences.